Welcome to the Making Kids Count podcast, brought to you by Kentucky Youth Advocates, where we sit down with policymakers, community leaders, and youth to discuss ideas to make Kentucky the best place to be young. Now here's your host, Terry Brooks.
As many of you know, the Anna E. Casey Foundation annually releases the consummate report card on kids, America's Kid Count Report. That national release tells us how Kentucky is faring, both compared against our past track record, but also how Kentucky is faring when it comes to kids and youngsters in other states. Then late in each calendar year, KYA, as Kentucky's Kids Count group, releases a state data report where we dig more deeply into the state of kids in the Commonwealth in general, and we also disaggregate every data point by county. Let me preface the rest of this podcast by acknowledging the sponsorship of Aetna Better Health of Kentucky, COSAIR for Kids, the Kentucky United Methodist Homes, and Save the Children. Without these groups, we simply could not tackle the work at hand. So as I think about this year's Kids Count release, the concept of a trope emerges. Trope, T-R-O-P-E. The Oxford Dictionary defines a trope as a significant or recurring theme or motif. Literary scholars often define genres of fiction based on tropes. For instance, common literary tropes in fantasy fiction may be the quest or the hidden world. In romance, you may have read a book or seen that plot played out on a Hallmark Christmas movie based on tropes like the first meeting cringe, friends to lovers, enemies to lovers, or second chance love. Mystery plots, they are stockpiled with tropes like the grizzled detective, the amateur sleuth, and the small town with hidden secrets. In comedy, the paramount trope is the good news, bad news setup line. You've heard it a million times, right? You know, the teenage driver walks in and says, "Do you want the good news or the bad news?" "Give us the good news," the dad responds, and the son says, "Well, the airbags work perfectly on impact." Or did you hear about the doctor and the patient? Or the mother-in-law? Or, well, I won't go on. Let's get to Kids Count. Can I simply tell you that the summary of this year's Kids Count is in many ways, that good news, bad news trope. As an example, the level of childhood poverty improved in 111 counties. That isn't good news, that's great news. And yet, can we see the level of childhood poverty in the Commonwealth as anything but bad news? When 1 in 5 kids, more than 200,000 little boys and girls, woke up today in that economic situation. And that more than 40% of kids in Eastern Kentucky are growing up in poverty, and that disproportionate rates of poverty for Black kids continue to haunt every region of the state. Good news, bad news. It's true for education. The good news is that 96 school districts saw math scores improve for 8th graders. And yet, is it anything but bad news that only 40% of those 8th graders meet minimal, emphasis on minimal, not optimal, proficiency in math? Along with some good news and bad news data, we also have some amazingly good news ones as well. I like that trope. As an example, the rates of kids entering foster care and the rates of kids exiting foster care and being reunited with families improve significantly and in very meaningful ways. And our track record, on issues like kids being covered by health insurance and teen birth rates continue to point toward a brighter future for all of our children in the Commonwealth. Good news and bad news, good news and good news. Well, you know what's next, right? Bad news and bad news. And I have to tell you, no bad news arena leaps out more than the issue of food and nutrition. When it comes to food, it seems as if we have a bad news data point followed by a bad news data point. I mean, today, 21% of our children will not have the food they need. And the trend line on that front, 119 of our 120 counties. I'm going to say that again. 119 out of 120 counties are experiencing worse rates of food insecurity. 40 counties reflect a rate of 25% or higher. And yet, in what is a quizzical juxtaposition of data, while too many kids are going hungry, too many kids are also obese. 1 in 5 kids in Kentucky today are unhealthy in that regard, which is not just higher than the national rate, but is part of a national trend where the increase in obesity among children has increased over 270% from the 1970s. It's because of that last data focus that we are digging into nutrition in Kentucky's kids a bit more deeply on this podcast. As you may know, the Kentucky General Assembly responded to the national Make America Healthy Again movement with real wisdom. Instead of chasing a myriad of issues that the national conversation reflects, our lawmakers have chosen to focus on nutrition and kids. So I am so appreciative of our lawmakers' wisdom in that regard. And secondly, I am so impressed by the acumen and commitment that members of the Kentucky Legislative MAHA Task Force exemplify. My colleague is going to be facilitating a deeper dive into Kentucky MAHA with that particular focus on food security and nutrition with two of the vital members of that task force. Thanks for being here, and I look forward to hearing the conversation to follow. This is Terry Brooks, thanking you for joining us in yet another Making Kids Count podcast.
Really appreciate Dr. Brooks for laying out the framework of our Kids Count work, and we are going to take some time to really dig in and get a closer look at the takeaways on the latest child well-being data that we've got, and a particular focus on child health outcomes and a continuation of our discussion on the Make America Healthy Again movement here in Kentucky. I am Shannon Moody with Kentucky Youth Advocates, and I am joined today by two esteemed members of the MAHA Kentucky Task Force, Senator Shelley Funke Frommeyer. She's representing Senate District 24, which includes some counties in northern Kentucky, Bracken, Campbell, part of Kenton, and Pendleton. And then also we are joined by Representative Adam Moore, who is representing House District 45, which includes Fayette and Jessamine counties. And we're going to jump in here with some conversation. I'm really looking forward to hearing from both of you all today. And we know that there are so many facets of child health that make that you all are considering within the task force and that are important for us to think about for the future of Kentucky and the future of Kentucky's health, whether as our children grow up. So Senator Funke Frommeyer, as co-chair of the Make America Healthy Again Kentucky Task Force, can you talk a little bit about why this task force chose to focus on child nutrition?
I sure can. Thank you so much for having us as well. The task force came about as my third legislative session started in January, and fairly quickly looked back and said, why is wellness not the priority around every piece of legislation that we might put forward? Because if you don't have a well young person that shows up to school to learn, or if you don't have a well member of your employment team, even you as the leader of the company, if you're not well, then are you going to institute the best version of yourself to learn today, or are you going to be the classroom disruptor? So fairly quickly, I recognized that if we don't wrap our arms around this very meaningful movement that was created by locking arms with President Trump and locking arms with Kennedy, then we're missing an opportunity, because I've already seen it in my very brief time serving in the legislature. But let's make it simple around, what do you have the most control of? What do you personally have the most control of? And that is, what do you put in your mouth? What time do you go to bed? How well do you sleep? And what sort of movement do you participate in on a daily basis? So that's candidly how we decided upon these priorities around our task force. Is, let's go first to, what does an individual have the most control over, and then bring that into the regular conversation of our legislative process of, yes, but what are we mandating certain things, or are we making certain things available that might even be harmful? And no surprise, supplemental nutrition assistance program was one of the very first things that we discussed. So I'll stop there, but there's a lot of excitement and passion. And offline, I mentioned that we just had our 9th grandbaby yesterday. So I come at this from a very holistic perspective as a mother of 6 and a grandmother now of 9. And I want to set everything that I have control over, sort of that tone, and my actions and my behaviors to align with being healthy and well and strong and capable.
Yeah. Well, I know we at KYA are really grateful that you're taking a look at kids' issues on a holistic approach, right? We can't just look at a singular area and identify solutions, when we know that community and environment have a lot of impact on the way that our kids have access to nutrition or don't have access to what they need in order to be healthy. So, Representative Moore, just based on your experience with the task force and your interest, what do you see as most important as far as what the task force has been working on when it comes to child health and nutrition, or what are the current reflections that you have based on that work that you've been doing?
I think it's very important that we all bring our own unique and individual backgrounds and experiences to this. Senator Funke Frommeyer, as chair, just spoke about, in addition to being someone who's cared deeply about health for her adult life, she's also a mother to 6 and a grandmother to 9. And she's going to bring those experiences and that caring and compassion into this. I'm a father to 1, but I want, of course, Remy, my son, but any kid in Kentucky to have every opportunity to be healthy now earlier in life. But that also leads to health throughout the rest of his life as well. So that's what we're bringing to it, of course. You talk about, do all kids have what they need, the resources they need? And I really appreciate that you all published the Kids Count Data Dashboard, but it shows that there are just so many kids and households that are facing food insecurity or low income, or they just don't have access to healthy foods. Senator Funke Frommeyer talked about having to make the choices of what goes into our body and how we spend our time moving and getting that physical activity. But not everyone has the same opportunities right now to make the same choices. How can we make this the healthy choice, the easy choice? I think that is part of what we need to do. And as far as like my role on the MAHA task force, bringing into it my background as a health and fitness coach and being a parent and someone who cares about our kids, I'm coming into it from that mindset of, how do we make sure that we stick to what the facts are, where the science is? A lot of us as humans, we come to any situation from a place of emotion, because emotion is innate and it's inside us. It's in our gut and it's in our heart. And we want to bring that into every conversation. And I wanted to make sure that we didn't let emotion carry us into directions that may not lead to an endpoint that is based on science and reason. And we've done a great job on that. Senator Funke Frommeyer and co-chair Matt Lockett have done a great job of bringing panelists and guests who lead with facts, who lead with science, who lead with data. And so I've been really interested in making sure that we're following those facts, following that data, to not just having all the answers, but learning to ask better questions, because that's going to bring us to a better place by the end of the day.
Yeah. Well, we're really glad that the task force is taking a look at the data and bringing in folks from different agencies and different perspectives to really understand the landscape overall of child health and how it's impacted by different factors and policy or practice or the adults in their lives. So the latest Kids Count data that you referenced, Representative Moore, highlights that nearly 1 in 5 kids ages 6 to 17 are obese in Kentucky, and nearly 1 in 3 live in high poverty neighborhoods, which we know increases the risk of obesity because of that lack of access to healthy foods and usually an increased access to those ultra processed foods. So, these data points really underscore the need to consider practical solutions, which you all are talking about within the task force. Can you talk about that statistic and what comes to mind when you think about the implications for our kids and for our future generations?
Yeah, I'll jump in there. Childhood obesity is going to increase the risk of chronic disease. Hunger affects a child's ability to learn, their mental health, their behavior in the classroom and out of the classroom. So all these children, we're talking about 1 in 5 who are obese. I think it's 40% in the dashboard who are not as in poverty, but are in low income or in a scarcity environment right now. With so many kids growing up in an environment that is shaped by that, it just makes everything else that much harder. Their physical health, their mental health, the ability to do schoolwork and to learn. And eventually all that leads to them being able to be a productive and healthy adult for all these years of their life. We think about the human side of that, but also we deal with taxpayer dollars in the state legislature. We want them to be productive citizens that are earning good money and paying into that tax pool as well. And so all of that is going to be started and framed and shaped by those decisions and the opportunities and environments that they're in right now in these early years.
Senator Funke Frommeyer, based on that data, do you have any what further reflections does that bring you to? Or I know you talked about practical solutions and making sure that individuals understand their own personal choices that they make, but on a community level, what does that bring to mind for you?
Sure. In fact, my Senate district is a microcosm of the state. So I serve the very rural areas of Bracken in Pendleton, even southern Campbell County. And then I serve that urban core of Bellevue, Newport, Covington, Dayton. And a really great example is some coordinated efforts by our mayor of Louisville with our commissioner of agriculture, working closely with the Parks and Recreation to say, what could we do with property that all the taxpayers are already locking their arms and creating some really wonderful environments for families and community? And how about we work together and build some raised bed gardens and looking for ways of making that, because we also know from a wellness perspective that the more we spend time in community with one another and doing productive activities together, literally productive from seed to harvest. And then even in our educational process, let's add and improve, and Representative Moore has got great ideas here as well, and several other legislators are putting some changes, requested changes into curriculum around how do we better inform from a very preschool all the way through to high school of the nutritional value of whole foods, of whole vegetables, whole fruits. And by the way, Kentucky, again in my Senate district, fantastic at production of beef and pork and poultry. And then take that into our school system, into our hospital system, as food is medicine. But the challenge, as Representative Moore and I also saw, is you've got about 13 to 15 inches of compliance that you've got to follow just to prepare lunch or breakfast for our kids. So it almost became easier, or has become easier, to prepare or not prepare at all. Some of our newly built schools don't even have kitchens. So what were we thinking when we're spending, again, the taxpayer dollar to rebuild some of our schools, but not even provide an environment where you can even prepare delicious food? You're just warming it up. If you're warming it up, it's probably processed, if not ultra processed. So we are going to work to change the tide towards more of a farm prosperity. That how can we create some rural prosperity and some farming agreements in our procurement processes? What can we do? And I'm going to give tremendous props to Commissioner Shell, his efforts to break down some of these procurement barriers that just seem too challenging. Well, they are. And he's persisting, along with some wonderful resources and help on his team, to break down these barriers that procuring will improve. And also, we've seen out of DC that the FDA standards are changing as well, and they must. And the USDA guidelines are changing, and they must. If they don't, then we're still faced with guidelines in our schools, guidelines in our hospitals, guidelines in our prisons, by the way, that are providing food that isn't promoting the optimal mental, physical, and emotional wellness. So working on how can some of our local farmers, the statistic was staggering. And Rep Moore, I'm not sure if you were there on our particular task force, when we learned that about 80% of the food served in our schools, if it's a fruit or a vegetable, probably was not even grown in Kentucky. Actually, it's closer to like 95%, but grown in the United States is about 80%, not even grown in the US. So, whoa, when you think about that missed opportunity and Kentucky's ability to produce and grow such a beautiful, abundant state, we often say impoverished, maybe impoverished in spirit, but certainly not impoverished in beautiful natural resources and our ability to grow and optimize our beautiful farm space.
So, Senator Funke Frommeyer, you'd spoken to, I think, some of the things that you all might be looking at then as you move into the 2026 legislative session, maybe addressing some of the regulations that can reduce access to fresh foods, especially for our schools and other sites that provide nutritional food to young people. What other, and changes to the curriculum in schools around what they're learning? What other changes do you all anticipate, whether it's investment or policy changes for the 2026 legislative session coming from this task force?
Yes, and I'm hopeful that Representative Moore is going to answer this question the way I believe he will, because we do believe that motion and movement is medicine as well, and we've lowered our expectations to a point that it is truly difficult for most of our children, including our high schoolers, to get the dose of vitamin D right from the sunshine, and really get just a little bit of movement to reset their brain so they can go back into a learning environment. But I do think you'll see us work with diligence on the procurement process and how we increase our expectations of the amount of whole foods and the reduction in ultra processed foods that are being purchased with the taxpayer dollar. That includes supplemental nutrition assistance program. Those are taxpayer dollars. And we're trying to supplement nutrition. And we've kind of gone awry there just a bit. I think you'll also see that we'll continue to address opportunities around coordinating more closely with the functional medicine side. We did invite our insurance companies to come to the table and give us a little better understanding on what's their approach to proactively keeping people well. So what sort of, if you paid your premium, what is your insurance premium buying you? Do you have the opportunity to utilize certain whole food supplements, or could food even be a prescription? So invest in farms more than pharma. So I think that you'll see us puzzle through trying to be careful around mandates. I'm not a big fan of telling people exactly what to do. I'm much more interested in providing them information, because a person convinced against their will is unconvinced still. I think Abraham Lincoln said that. And I truly see it in my own life, and I don't want to be over legislating. It's important to me that we don't grow our government in this process.
Yeah, yeah, and I'll jump in there. The Senator talked about all these regulations and how it's easy to be overly cumbersome, and literally, they brought in stacks of documents as far as here's this thing that's 200 pages, here's a thing that's 300 pages, all these guidelines they have to follow. I'd like to see us work on these regulations not being a roadblock to able to have health, but how can we provide them a road plan instead? And I think that's what Senator Funke Frommeyer is talking about there. Uh, as far as what the Agriculture Commissioner Jonathan Shell is doing, I want to echo my praise for what he's doing with both his agriculture as economic development, but also expanding and creating a food as medicine program here in Kentucky, where our Kentucky farmers are partnering with healthcare centers, but hopefully we'll partner with our schools here as well. Talking about making procurement easier, I would like to see a statewide procurement contract, and that allows schools to not have to each one individually go into it. How do we get Kentucky grown produce, Kentucky farmed proteins into our schools and make it easy, efficient, and affordable? That is something that we can do that doesn't require burdensome regulation. It just as us facilitating those opportunities that are already out there. Again, Commissioner Shell, too, he brought up a great point. You know, we might be able to raise chickens in Kentucky, but we don't have places here that actually makes the chicken nuggets that end up in the school lunch line. So things like that. How do we go from the farm and field itself to the lunchroom without that product leaving Kentucky, having to be more processed so that it's shelf stable, it's frozen and sent back? To start to build up those things here that will mean we have fresher food in Kentucky for our students, but also that's going to be jobs here in Kentucky at the same time. So really looking forward to opportunities for that. Local school wellness policies. Not everyone knows that there's already a mandate that every school district has a local school wellness policy. But the way that those are carried out has great variation. There's very little public transparency in those. Can we make it so that there is a standardized reporting format, even if the recommendation of each school district isn't the same? Because some areas are going to have more poverty. Some areas are going to have food deserts. Some areas may not have nurses available, and they might need more nurses there in the schools. So there's going to be individuality there in those local school wellness plans. But how do we increase the reporting and the transparency so we know that they're working? You already have a plan. Can we track that it's working? And now the students are healthier. They're not having to have sick days. They don't have to go to the hospital or to the doctor. They can be there in school, and they can be learning, and they can be thriving. And then, of course, Senator Funke Frommeyer talked about physical activity. And of course, that's a passion of mine. When I'm not being a legislator, I'm a fitness coach, is mostly my day job. And for a lot of people, giving physical activity is not going to mean lifting weights in the gym. How do we get them moving their body, though? Whether that is outside, getting that vitamin D at the same time, but some way that they can have an appreciation and hopefully a love and a passion for moving their body, using their body, taking pride in what they've been born with and what they're going to have with them for the rest of their lives. And that will be a stave and a hedge against future chronic pain, decline into so many things that are tied to being overweight or obese, whether that is diabetes, heart disease, and all of these other things as well. So there's a lot of things that we can do without doing overly burdensome legislation, but we can hopefully guide people on a kind of a roadmap to hopefully better results.
Well, I'm incredibly encouraged to hear about, and Senator Funke Frommeyer, you had mentioned the movement in schools and movement of our students for a number of reasons, right? We know that there's evidence out there that talks about the benefits of movement for students who maybe are struggling with trauma and the issues that they experience at home, coming to school with them, being able to move and move their bodies and kind of process things as they go can show up
really well for them in the classroom. Same with students who might have ADHD or other things that could impact their ability to focus and concentrate.
Yeah, in fact, I couldn't resist imagining in my mind, Adam, that instead of a person's school supply list, that again, I've seen a lot of these in my years as a mom, that the supply list often says bring your 2 or 3 containers of Lysol wipes. I'd like to see you bring a yoga mat instead. And then you can train those young people that, oh, by the way, you only need a space that's about 5 foot by 2 feet, and you can do push-ups, and you can do shavasana and just lay and calm and center your mind. I just think it's just not so complicated. Boy, have we made things complicated.
Yep. It doesn't need to be an hour-long fitness class either. 5 to 10-minute breaks during the course of the day will help refocus students, and then they'll actually be more productive and they'll learn better in the next class.
Yeah.
Go ahead.
Well, that's right. And in the scheme of things, it's not that complicated. And we have absolutely some of the finest educators that are right there with our kids. And I mentioned that I just left our pension benefit and oversight board meeting. And as our meeting was wrapping up, and we'll reconvene here in just a few minutes, the discussion around our amount of dollars that we spend on administration has grown dramatically compared to the amount of students that has declined. And I would like to see that figure lean more heavily on the growth of the teachers' compensation and the decline of the administration, the quantity, so that dollars are spent differently. And we know that this wellness can occur, but we're spending dollars a little differently and maybe not as close to the student and the result of the student. So maybe we spend a little more in the lunchroom on quality food, and we spend a little more on the educator that is also helping to offer fitness breaks and mental breaks and things. There's just things that now, sitting as a senator, not sitting, running, jogging in place as a senator the last 3 years, I'm seeing things in such a different lens, and somehow we've lost track of just some of the basics.
Well, I'm grateful for the time that we have had with you all. Before we wrap up, I just want to offer an opportunity. Any final reflections or comments that you all would like to make on the overall work of the MAHA Task Force when it comes to thinking about kids in Kentucky before we close out?
Yes, I'm just going to acknowledge that I am so appreciative of our Speaker of the House and our President of the Senate for giving us the opportunity to come together as a task force this legislative session. It has been impactful. Every visit that we've had together has been at least 2 hours, and we promised we would keep it to about an hour and a half. And then even our committee convened at the University of Kentucky with the invitation of President Capilouto, because UK does have such an input into our 120 counties and our extension offices and our nutrition education through the supplemental nutrition program. Just such an emphasis. And I just want to thank Representative Moore, and I want to thank my co-chair Lockett, and our 4 senators and our 4 House reps that came together, really giving fully of themselves and pulling people into the task force. Maybe we'll have a MAHA 2.0, I'm hopeful, but our 1.0 has been very beneficial and impactful, and I think we'll see some good results.
And I want to thank both our chairs, Senator Funke Frommeyer and Chair Lockett from the House side as well. They have brought in fantastic speakers. I have learned something in every single meeting that we've had. And every time I've raised my hand for a question, they have always called on me. There's never been, nope, actually, either you're too junior or we don't have enough time. They've allowed me to ask my questions and address our speakers whenever something does pop into my head. And I really appreciate allowing for that environment that we can learn, and we can kind of foster discussion and dialogue. And one thing that's been cool being on this as my first task force as a legislator, this has been the one I've been asked about the most. And not just from news media, just regular people who I coach at the gym or I'm friends with, or other parents that Remy goes to school with. That's what they hear about and they read about, and they say, Adam, so what's going to come out of this? What are we doing? And I get to tell them about how the government's actually working on finding good solutions for them. It's been very exciting.
It sounds like this task force has been an opportunity not only to explore some really practical common ground solutions, but also for our legislators to sit and learn about all of the opportunities that are available for our kids and families across Kentucky if we take some action and create some opportunities for some localized approaches even. So I'm so grateful to you all for spending some time with us today and illuminating us on what's going on with Maha, Kentucky. And we're definitely looking forward to what the task force recommends and moves into for the 2026 legislative session. We do encourage our listeners to visit kyyouth.org to check out the latest Kentucky Kids Count data dashboard that was released recently. And then again, thank you, Senator Funke Frommeyer, Representative Moore, for serving your district so well and being so present and active in the Maha Kentucky Task Force and thinking so clearly about what Kentucky's kids and families need to be healthy. So thank you again.
Thank you.
Thank you.
All right.
Thank you for listening to the Making Kids Count podcast. For more information and to listen to more episodes, visit kyyouth.org/podcast. To support this podcast and our mission as the independent voice for Kentucky kids, please consider making a gift at kyyouth.org/donate.